Let's open up, guys. What do you think about why are so many botanicas sprouting up? Not only Latinos are going to them, just opening up to anybody.
Because people want hope.
Okay.
Hope is critical. I mean, that's why people believe in God, believe in religion, and that's why they believe in something that says you're not doomed. The future is not black and white for you.
Apparently, statistically, the more people who seek alternative medicine are people who are in advanced stages of chronic disease. Correct. So, other reasons why the botanicas.
That, you know, in botanicals, Chris, you can find a lot of remedies from our countries, Latin America. You know, you can find a lot of stuff up there that we were trained to use when we were growing up, and for some reason, you know, they sell it at these places.
Well, you were trained to use.
Yes, I was trained.
Because you've been a healer since you were quite young.
I kind of feel that since I was a little kid, yes.
So it was just something you sensed.
Yes, I saw my aunt, you know, when she was preparing all these things, and when I came here and I saw so many botanicas, I said, I've seen this one before, I've seen this one before, you know, looking at the herbs, you know. We're
going to get to a little bit more about you and your tias and the whole thing. Doctors, the botanicas, why are they sprouting up?
I think when people get pretty desperate, they'll turn to anything. I mean, if their aunts or their uncles have been using it for years and they tell them that it works, then they might use it because somebody they know that they trust has used it in the past and maybe it worked, and they're going to try it. I mean, anything, you know, they'll try anything.
Dr.
When they're desperate enough.
Without disagreeing with any of the panelists, I would.
You wouldn't want to do that, would you?
Well, I may. But with regard to, I think the most important reason, I think, is the lack of insurance. The largest percentage of uninsured is in the Latino community. And if Latinos had insurance, I think that they would seek traditional providers and probably less non-traditional providers.
Now, you practice for many forms of alternative medicine, including yoga. What can you actually heal, though?
Usually, Chris, when I say healing, you know, it's a lot of psychological problems, emotional problems. And some of those, you know, are the ones that I have seen, you know, the people who I work with, that has to do with a lot of illnesses, you know, stress or headaches or...
You guys all buy this?
I agree with him in that sense, that a lot of the problems, medical problems that people have are psychosomatic. A lot of people that are anxious are having headaches, different kinds of problems you can have that are basically psychosomatic. There's no organic problem there. In that case, if you help them emotionally to make them feel better, then they may get better.
They're not really psychosomatic, they're neurosomatic. It's not a mind-body problem, it's a brain-body problem, because the human brain is eminently plastic, and the mind can alter the circuits of the brain in a real concrete fashion. That's not hocus pocus, it's reality. It explains things like obsessive-compulsive disorder. Therefore, if your mind can be altered by him or you or whoever, and then can alter the brain in turn, and the brain's ability to alter the various systems in the body in a real concrete fashion, you can modulate the immune system.
So it's the power of belief.
Truly.
Okay, and if we buy that the power of belief and the power of brain, you know, it is real energy. Dr. Franco and Dr. Urrea, would be adverse to a patient that said, you know, if I light these candles, I feel better. Or if I go see curandero or someone from my old country, I feel better. Would you be adverse to telling him, then go?
I think it'd be a problem if the candles were charged $1,000 per candle, or if the patient were kept from receiving life-saving treatment in lieu of going to the candles. I think it could be a problem. But the candles in and of themselves are not going to be a problem.
But it stops people from going to regular medicine. If you have breast cancer and you go into a belief system like that, and as a result fail to take care of yourself in terms of mainstream conventional treatments that you know darn well are going to work, then that's bad.
No question.
Well, have you ever had anyone try? Well, what were you going to say?
Yeah, what I was going to say.
I want to ask you, has anyone ever tried for you to do a miracle?
No.
No?
No miracles.
Like, cure me now.
Right, but what I was going to refer to what the doctor was saying, a lot of people come to see you, right? If I see someone that is really has a very deep, you know, medical problem, I say, you know, go and see a doctor. I believe that healing, alternative medicine and medicine in general, you know, they go hand in hand. I would never keep a person who I see depleted, you know, health-wise. I say, you know, you got to go and see a doctor. And I would recommend it, you know, for them to go and see the doctor. Then I say, come back if you wanted to. A lot of times, you know, doctors, you know, they're always prescribing medicines. They're always prescribing these pills. And I strongly feel that a lot of times, we don't need all those pills.
Do you guys think
we can do something
doctors are
different
overprescribing?
What I think is that because of the HMOs, doctors are in a rush to see patients. They maybe see them for 5 minutes. I'm not including myself because I do not accept HMOs. I don't practice HMO. I practice, you know, that's not my practice. I at least spend 15 minutes with my patients. In the old days, doctors used to spend maybe half an hour, maybe even 45 minutes with the patient. Now they can't do that anymore. They can't evaluate the patient adequately enough to be able to say, I think this is what we're going to do. You know, they quickly are prescribing now because they're rushed. They're seeing they're seeing about 50 to maybe 100 patients per day per doctor.
When I came to this country,
HMOs.
this had the best medical care in the world. Now we're down beside Cuba. This wealthy country can't do any better than Cuba. For God's sake, what's wrong with it?
These are all valid criticisms,
Thank
and
the
I think
HMOs.
that the doctors don't spend enough time with their patients because of the economics, and I think that there are problems that result from that.
Yeah, and a lot of times too, you know, I feel that there is no sensitivity. You know, I went to
sensitivity to
in terms, you know, to the client that they're seeing. You know, I just went to a doctor, you know, for the physical. I couldn't believe it. 15 minutes, and he was like, you know, like a robot, you know, asking questions. He didn't even look at me. And then
were you dressed like that and he didn't look
at you? No. In my suit, in my tie. Remember, this is my other.
Told you, heal me.
This is my other part-time. But you know what? He said, you look pretty good. Yes, I mean, you feel like you are very healthy.
Yeah.